Hi, I'm Dr. Tony Mork, endoscopic spine specialist, orthopedic surgeon. And today I'd like to talk about a term that's commonly talked about and that you may see in your radiology reports. It's a term I don't like very much because it doesn't have very much meaning. It's not very specific. That term is spondylosis. And what spondylosis does is it refers to general osteoarthritic changes of the spine, whether it be cervical, thoracic, or lumbar. But it doesn't really have anything to do with where you hurt, which is the main reason people are getting x-rays, CAT scans, or MRI scans. It really only has to do with the radiology report. And it really only talks about or kind of gives a general reflection of wear and tear. Osteoarthritis essentially is a wear and tear change. Just like we have parts in our cars that wear out with time, that is the basic concept of spondylosis. It's a very non-specific term that means that things are wearing out. Let's talk a little bit about more specifically what it means. In this picture here, spondylosis can mean that you've got narrowing of a disc space. Now here is an example of a disc space that's still intact. We've got some space here. It's a little narrow in the back, but not too bad. As we move up to these other levels, we have a significant loss or complete loss of the joint space or the disc space. And not only that, there's also calcification of what used to be the soft tissues. And actually, we can even see some subluxation. In other words, this vertebrae has maybe even moved backward on this one. So we've got even some spurring. So this does not tell us anything about pain. It really just tells us that we've got some osteoarthritic changes which may or may not be a problem or even contribute to a problem. I know that this gentleman does not have any back pain, even though his vertebrae here are touching and there's calcifications off the back here. Even this little area of subluxation is not hurting him and causing him back pain. On the other hand, what is causing this guy some back pain is this. So I'm able to move the slices here, and I'm going to show you where this guy does hurt and why. He hurts because we can see that spurring is part of osteoarthritis. So osteophytes and spurs are essentially the same thing. It's as a result of narrowing of the joint spaces and loss of this, creating some wear and tear changes. And actually, as a byproduct, you get some spurs or calcification. Well, why is this a problem? In other videos, I've talked about stenosis, and particularly foraminal stenosis. And we can see that foraminal stenosis could be a result of spurring of the facet joint. So here's a facet joint. Here's the nerve that's coming out that would get pinched. Let's look at it in what the CAT scan shows us. Here's a spur that sticks up into the foraminal canal and would be probably sitting on top of the nerve that passes through here. So we've got a calcified spur that actually pushes into the nerve root as it leaves. And in this gentleman was causing him some pain way over on the side of his back. Not the back, but over, out toward the outside of his back. So I want to just show you some other levels that have exactly the same problem, although in this gentleman they were not symptomatic. These are fairly small foraminal canals here, and up here we see another small foraminal canal with a spur from the facet joint sticking into it. Another example I'm going to show you of arthritic changes in the spine, in addition to disc changes, are changes of the facets, which showed spurring in those films, but they can also just be abnormally large. So in the next film, I'm going to show you an orientation of the spine like this, where we're looking down the spinal canal. You can see that the discs and all here, the spinal cord is here, and then the facet joints are in the back. Let's take a look and see what it looks like on the CAT scan. Here we see the disc here, which is calcified. You even see some fracturing of the annulus and the calcification of the disc with almost a big fragment coming out, and it's pushing into the foraminal canal. So it's this fragment here is pushing into a place where the nerve should be. There's no even joint left of the facet, so the facet joint is gone. On this side, the facet joint is gone, and you can see these calcifications that come out and push into they can push into the nerve root trying to get out. In addition to the foraminal stenosis that they can cause, we can also have central stenosis, this is where the cauda equina or the remnants of the spinal cord are located as well. So spondylosis is a general term reflecting osteoarthritic changes. It's a radiology term. It's not a term that I use very often just because it's meaningless. It doesn't specify to a certain place. It's very general, and it doesn't specify where you're hurting. So it's a term I tend to avoid. Hey, listen, thanks a lot. If you got any questions, be sure to ask or check into my website, drtonymork.com. Thanks.